Question for short debate. People with learning difficulties or autism. Detention in secure settings. Baroness Hollins.
My Lords, more than 2,000 autistic people and people with learning disabilities are currently detained in hospital, mostly inappropriately. 2 years ago, the Secretary of State asked me to review the care of 77 people who at that time were being detained in long-term segregation. The number is now 100. My ICETR oversight panel includes people who have experienced long-term segregation themselves, family members, mental health, housing and social care experts. These 77 people have all now had independently chaired education, care and treatment reviews. We examined the first 26 of the 77 reviews in depth. What we found was profoundly shocking, and we identified several areas for urgent improvement, published in a thematic review. Typically, they had past histories of poorly commissioned education, therapy and care. There was little clinical continuity between hospital and community services, no clear therapeutic purpose for admission, and inadequate clinical assessments with little recognition of previous trauma or its implications for mental health and behaviour. The Oversight Panel and NHS England have worked with the Royal College of Psychiatrists to develop a new clinical contract to try to ensure active management and therapeutic benefit. My Lords, we found that more than half of the people we reviewed were autistic people, both adults and children, but the hospitals where they lived and those responsible for helping them move back home lacked much understanding of the autism-friendly environment or the care needed by autistic people. Most of the people reviewed were either ready to be discharged or to start a transition process back to their community. Repeated past commissioning failures were compounded by poor commissioning responses to the ICETRs. Apathy, bureaucratic delays were part of the problem. Professionals not turning up to meetings. Agreed action not taken. Wrangles over who pays for what. We saw interminably slow processes keeping people in situations that were at best inappropriate and all too often violated human rights. One woman had reportedly been ready for discharge for 19 years. I asked the Noble Lord the Minister how Her Majesty's Government will ensure that ICETRs are being taken seriously by commissioners and that commissioners will be held accountable. As part of our review, we gathered and published good stories of people who had managed to live happily in their communities after being discharged. It's called Helping People Thrive, and it was written to inspire commissioners and clinicians. Mr. W was one of those good stories. Prior to his discharge, he had been detained in hospital for more than 20 years, spending most of his time in what amounts to solitary confinement. My Lords, Mr. W has now lived in his own home for nearly 3 years, near his family. His home environment, his care, have been built around his needs. It costs no more to support him in this way than it did to detain him in hospital. Most importantly, despite still recovering from the trauma of being in the wrong environment for so many years, he is now happy. We're pleased that our recommendations, both for senior intervention, a form of intensive case management to assist in overseeing discharge arrangements, and for the continuation of independently chaired reviews, have been supported by Her Majesty's Government. Some people we reviewed had social workers, advocates and families that were trying hard to move them back home, but a lack of local housing and care providers with the expertise needed was hindering their plans. My Lords, a key part to successfully supporting someone in the community is the provision of good quality housing. Sometimes commissioners are persuaded that moving the person to a single person residence in or near the hospital is the solution. But such interim moves make it less likely that the person will ever move properly back into their own home community, and it incurs continuing high fees for commissioners. How will Her Majesty's Government ensure that there is enough housing without months or years of delay? We must do everything we can to give people a choice to live where they want and with whom they want to live, just as we all do. Sometimes people tell us through their behaviour what they are unable to put into words. Recognising what it is that they are trying to communicate and helping them find a way to understand their feelings is often what enables people to move on from patterns of destructive or difficult behaviour. Good relationships with care staff are key, as shown in Dr. Rebecca Fish's recent research. Speaking as a mother and former practising psychiatrist in this field, I believe that much more attention needs to be given to really listening to people and enabling them to communicate what is troubling them, using whatever communication method works for them. Books Beyond Words, and I declare an interest, it's the charity that I founded, creates word-free health and social stories to help people communicate their hopes and fears through the universal language of visual communication. And Respond, the only specialist charity in the country offering trauma psychotherapy for autistic people and people with learning disabilities, is overwhelmed with referrals. Medication continues to be the main response to challenging behaviour. When will Her Majesty's Government invest in widely available psychotherapy and specialist trauma therapy for people with learning disabilities and for autistic people? Current community mental health and learning disability teams are rarely well equipped and resourced to provide the support needed for traumatised people. This deficit contributes to people's care arrangements breaking down and to hospital admissions. My lords, if we invested in good local care, we could properly support people being discharged from hospital and also prevent a whole new generation of people being admitted because of a lack of the right community support. My lords, the social care system is nothing without the workforce. The pandemic has shone a light on the extraordinary dedication and determination of those that work in care. It's now time to address the many issues which have faced the workforce for several years, but which the pandemic has strained to breaking point. Currently, we don't have enough staff with the right training to ensure that people's needs are met. Staff who can empower and support that person to live their life to the fullest, who respect them, who value them, who can create good relationships with them. Back in 2016, I chaired a report for Health Education England called Care Roles to Deliver the Transforming Care Programme. But little action to introduce effective training, supervision and meaningful career pathways seems to have happened. I recently visited care settings in Germany. I was impressed by parity in length of training, pay and terms and conditions for care staff, nurses, primary school teachers, occupational therapists and others. My lords, there were no staff shortages and services were much more joined up. How will Her Majesty's Government ensure that care providers with expertise to support people like Mr. W are available all over the country? Will Her Majesty's Government consider changing the rules so that care workers can enter under the Skilled Worker Immigration Scheme? I hope the Minister can reassure me and the House that the expected reforms to the social care workforce and the promised cross-departmental strategy will tackle training as a priority. Could the Noble Lord confirm whether recent recommendations from my oversight panel, but also from all the other recent high-profile reports, are being taken forward by the Government's new strategy? And finally, I ask the Noble Lord, will Her Majesty's Government consider making it a requirement, a statutory requirement, to report restrictive practices, including long-term segregation, and to publish details of commissioning organisations who still have patients in long-term segregation? Noble Lords may be surprised to know that many commissioning organisations who I've asked don't know if they have people in long-term segregation. For example, by making an annual report to Parliament about the numbers of autistic people and people with learning disabilities being detained in hospital, including those in long-term segregation, and naming the responsible authorities, and to report about the action being taken to develop effective care and support in the community, so that crisis admission to hospital due to local service failures no longer happen. My Lords, we've debated this issue many times and read so many shocking reports. It's time to end scandals and tragic deaths and to give people back their lives. The new strategy needs political support. It needs resources to untangle the bureaucratic web, to reverse the perverse financial incentives that seemingly trap people in hospital. I'm grateful to Noble Lords for speaking in this debate and for helpful briefings from MENCAP, Right for Lives, the Challenging Behaviour Foundation, the National Autistic Society, and from the Royal College of Psychiatrists. And I look forward to hearing everybody's contributions and the Noble Lord's response. Thank you.
My Lords, this is one of those occasions when I almost feel like saying, you've heard the Noble Baroness, that's about it. But I shall indulge myself by slightly following on from much of the things you said, particularly about training and staff. My Lords, if anybody who has done any work, and looking around this room, I say there are many people who've done more on autism than I have. Every time you go down, you realise how difficult it is for somebody with autism to interact often with the outside world, especially at the lower functioning end. Now, some can get through it, come out and make you understand what they're doing if you give them the time and if you have some training. Learning disabilities I have less experience of, my Lords, but if we just stick with autism as a factor here, these are people who have communication difficulties and perceptual difficulties, which means they can't interact well with you. And if they've got themselves in a position where people can't cope, often because they're becoming adults, and their demands on society and expectations are realistically higher, you're going to have people who are properly trained to interact with them. Now, if you haven't got those people and everything gets terribly difficult and occasionally frightening, pushing them away into a darkened corner is a perfectly understandable response. Yeah, I can see why people do it. It's wrong, it's damaging, it's expensive, but people do it. But once you're shoved away into a corner, and the point the Noble Baroness made about opening up everything is actually probably one of the key points here, because if you don't know what's going on, how can you possibly intervene and change it? The idea that you should open up is one of the key things here. Now, the government have accepted the situation we had a few years ago, made out by Winterbourne Mew, is unacceptable. And they have made some progress. Congratulations for that. Whenever that comes, the Noble Lord's been here long enough to know there's now, then comes the criticism behind it. But it isn't there yet. And it is not just about getting people outside, it's getting them sustained outside. So how are we doing with training? Has it become the norm that a person in a controlled unit actually does have training in how to de-escalate a situation without reverting to a chemical cosh or physical restraint? What is the relationship in the numbers between those people? I recently had a conversation with somebody who actually was a young man who was under training, this was about 23, went to a training unit to deal with this type of people, and he said they spent most of their time in arm locks. And he was one of the oldest people working in that environment. My lords, this cannot be right. Have you got a situation where people who are trained to do the communication and to de-escalate and make sure that you actually can have a civilized conversation, are they there? And are they there on all occasions? If you're not, you're actually just playing Russian roulette here, and something will escalate and go wrong. It's almost a guarantee. And once something goes wrong and you've got the problems I probably rather inarticulately described, somebody is going to be even more frightened than you or I would be if we were being contained. So trauma and mental health that goes with it is almost, and once again, almost guaranteed. It's just a matter of how bad it will be in individual cases. We've got a situation here, my lords, where we're all accepting that something should happen, or even actually reasonably agreed on what should happen. Getting a person out living as independently as they can, giving them enough support to do it. What action is the government making to make sure this happens? And that if something goes wrong when they are living independently, you can intervene and correct it without getting into more conflict, fear and trauma. Because that is what is required, my lords. It is the fact that you can communicate with that person. Now, across the disability sector, this is a very common structure. If you've got somebody who doesn't quite fit into the bracket you're talking about, and you try and make them there, square pegs, round holes, we can throw our own cliches at it. You will always get these types of trauma and lack of communication, lack of outcome. You also then lead to things like legal costs, lack of things, and a greater cost. Please can the government give us an idea of what they are doing to make sure the staff are trained to intervene and put people towards the correct, or should we say better solutions here. People have a right to live independently, they have a right to live securely. With a little bit of help, most of this group can do it, or at least for long periods of time. If the government isn't making that intervention, they are probably wasting money, first and foremost. And can the government give us an assurance that they are taking steps to make sure this waste of money that leads to a lack of human dignity and human rights is being corrected? Because without it, you are actually offending everybody at every level.
My Lords, I'm very grateful to the noble Lady Baroness Hollins, not just for the comprehensive introduction to this important debate, but for her work over so many years for people with learning disabilities and autism. I also want to pay tribute today to Professor Sir Michael Rutter, who died this week, and whose work in this area gave hope to so many families, including one known to me. It was Professor Rutter who diagnosed their 4-year-old son and offered them hope of a life in which, with the right support, he'd be able to flourish despite his challenges. As that young man turns 30, that same hope is in painfully short supply. My Lords, he is among the 2,085 people with a learning disability and or autism currently confined in an inpatient setting, a number that's risen by 40 over the last month. The average stay is 5.4 years. He's been detained since 2011, with around a third of that time in locked seclusion. Many of these people are not there, as we've heard, because they need inpatient mental health care. They are there because the right kind of community support is not available. And for some, these settings are not only inappropriate, they are deeply triggering environments in which they can be subjected to profoundly damaging practices that compound existing trauma, including segregation, restraint, and seclusion. The environment can be horribly reminiscent of the extreme deprivation suffered in early years. No furniture, no personal belongings, no family contact except through an intercom, treatment delivered through a small perspex window, no activities, no stimulation, no choice. The NAO has estimated that in a single year, 2012 to 13, the NHS spent £557 million on inpatient services for people with learning disabilities whose behaviour can challenge. These are vast amounts to spend on keeping people in situations that, far from helping, are causing untold harm. And there are perverse financial incentives underpinning this. While responsibility for community provision typically rests with local authorities, inpatient care costs are met by the NHS. The Commons Select Committee heard that this is a disincentive to local authorities to invest in community provision, as it would lead to more patients becoming their financial responsibility. This makes no sense. The Care Quality Commission estimates that hospitalisation costs roughly 3 times the price of community-based care. Government promised transformational change after the 2011 Winterbourne Views scandal, but progress has been unacceptably slow, with the target of a 50% reduction in inpatient beds now pushed out a further 5 years to 2024. In the meantime, vulnerable and blameless individuals continue to suffer. And so I ask the Noble Lord the Minister, when will government produce a robust, detailed, costed and evidence-based cross-departmental plan to deliver on this long overdue commitment? What will government do to ensure the right community support is in place, not just to enable successful discharges into the community, but to prevent admission in the first place? What steps will government take to build the much-needed capacity and skills in the workforce that the Noble Lord Addington has just spoken of? Will government act to remove those perverse financial incentives and redirect funding flows from poor care models to the development of robust community services? Will government stop commissioners from buying places in services that are failing to meet appropriate models of care? And will government deliver reform of the Mental Health Act, under which the vast majority of inpatients are held? Currently, people with a learning disability can be detained if they display behaviour that is challenging. But all too often this behaviour is not because of a complex mental health problem, it's because one or more of their social care, communication, environmental or sensory needs are not being met. And once admitted, they quickly get stuck in a system in which effective routes for challenge are hard to find. So what will government do to ensure that care, education and treatment reviews take place, that they involve the right expertise as well as families, and that recommendations are followed within specified timescales? My Lords, as we've heard, in the end, this is a question of human rights. The Joint Committee on Human Rights found that the detention of individuals in the absence of individualised therapeutic treatment risks violating their right to liberty and security, and that their rights to private and family life and to freedom from inhuman and degrading treatment are all threatened. Sadly, in my very limited experience, all of these ring horribly true. Those individuals who do achieve their ambition to return to community living leave traumatised by the experience they've undergone, with their families equally traumatised and frankly exhausted by their unrelenting fight to improve their loved ones' situations. It cannot be right that any one person should be failed so many times. Failed by the absence of appropriate services, then failed again through the treatment they've received in a place they ought not to have been. My Lords, 2,085 is a number too high, but it's also a number low enough that the development of individualised pathways to support community living should, in a civilised society, be an achievable goal. The costs might be high, but the costs of the alternative are far, far higher.
My Lords, I declare an interest as a Vice President of the National Autistic Society. Autism is not a mental health condition, but many of Britain's estimated 700,000 autistic people develop mental health problems, and too many reach a crisis point which could be avoided. This is often because they cannot access support they desperately need in the community, a point well made by the opening remarks of Baroness Hollins. Due to the way the Mental Health Act currently works, autistic people are at risk of being admitted to hospital and detained, not because they have a separate mental health condition, but because they are autistic. Not having enough services can be both the reason for an autistic person's detention or for preventing their discharge. Yet, as we know, my Lords, the Mental Health Act Code of Practice states clearly hospital is very unlikely to be helpful in supporting autistic people. More than 2,000 autistic people are currently in inpatient facilities. Over a third have been flagged as no longer needing care. And once detained, the average stay is almost 5.5 years. My Lords, this is an abuse of human rights, a point just well made by Baroness Bull. And as a former member of the Council of Europe, a body Churchill helped to set up to protect human rights, Britain should be ashamed of our record in this respect. So I welcome the NHS England long-term plan to reduce the numbers to below half the 2015 levels by March 2024. However, since the publication of the plan, there's been no significant reduction in the number of autistic people in mental health hospitals. Indeed, for much of the time, the number of autistic people in hospitals was increasing. In 2015, autistic people made up 38% of the number. Now it's 59%. Autistic people should be able to live lives in their communities, full lives, with families and friends. And the government must change the Mental Health Act to make sure that autistic people are not detained inappropriately in hospital. Changing the definition of mental disorder to remove autism and learning disability in relation to non-criminal justice-related matters is definitely the right step and to be welcomed. But we must provide the right community service support for autistic people with mental health needs. This must be underpinned by legal duties to have the right levels of support available in every part of the country. This can't be some sort of pick and choose and sort of system. And we must make sure all mental health services have the right training to fully support autistic people. And there is a huge gap there, a huge gap. Now, my lords, I welcome the rollout of the Oliver McGowan mandatory training in autism and learning disability, which is currently being piloted. But it must go further by promoting best practice, such as work recently done by the National Autistic Society in collaboration with Mind. More than that, we need to give talking therapists the guidance they need to make those vital early interventions work better, much better, for autistic people. So can I ask the Minister, what steps is the government taking to make sure that autistic people are not left behind in inpatient mental health hospitals when they shouldn't be there in the first place? How will the government make sure that all mental health services have the right training to provide quality mental health support to autistic people, because they don't have it now? And in particular, will the Minister commit to funding the full rollout of the Oliver McGowan mandatory training? How will the government guarantee that the right community services are available in every area for autistic people with mental health needs? Will the Minister commit to urgently reviewing and improving the commissioning of support for autistic people and people with learning disabilities? And finally, will the Minister commit to develop clear guidance for commissioners in each area and provide commissioning support for those areas that need it most? My lords, locking up autistic people in the way we do now is a stain on British society. We should be ashamed of it, and we should put an end to it.
My Lords, I too congratulate the noble Baroness Hollins for getting this debate. I actually want to spend a moment on those congratulations, because at a time of COVID, at climate change, of geopolitical tensions, it's really important that we don't neglect some of the smaller scale issues. Now, this is affecting 2,000 plus people and their families, but it's not millions and it's not billions, the billions who live on this earth. So in that sense, it's small scale, but for these families, this is massive. This is all embracing. I also note that COVID has affected different people differently and has been a healthy reminder of the inequalities in our society, and this is a massive, massive and rather hidden inequality. So congratulations to the noble Baroness, and for the way that the noble lady opened the debate, spreading out all the issues that are involved. Now, I just want to say a few words about the current situation, but I want to focus on the plan, the non-existent plan. We're talking here about 2,000 plus people, and 210 of them are children who have learning disabilities and or autism. Now, I've been out of touch with this sector for some time, but I sense from the briefings I've been getting at that all we're doing is warehousing these people. They don't need to be there. They're admitted because there's nowhere else for them to go, and they can't leave because there's nowhere else for them to go. Meanwhile, while they're there, they deteriorate. It's a dangerous environment for many. Goodness knows what it does for the children and their education, socialisation and development. Now, I know that there are similar things happening to acute adult mental health admissions, because I have done a recent review on that, and people are stuck in adult inpatient units. But the difference, my lord, is we're talking here about 5.4 years on average that people are in this situation. My lords, they go in now and come out possibly in 2027. Or looking backwards, they'd be coming out into today's world from the very different world of 2015. Or as a child growing from 11 or 12 to 16 or 17 through the early years of adolescence. And we can all imagine the personal tragedies, can't we, behind these bald figures. So what's the plan? And I mean, what's the plan, not what's the policy document? The noble lady Baroness Bull made the terribly important point that this is small enough to count. They can all go on somebody's list and somebody can tick them off when they're moved out of hospital. I've had a lot of great briefings from organisations, great descriptions of the problem, great advice. We know what good looks like. There are lots of overlapping recommendations. There's a lot of discussion of inspection and holding to account, but I don't see anything about personal responsibility and who is responsible for delivering the change. My lords, I joined the NHS in 1986 from a background in industry and the charitable sector as the, and this is those days' language, the unit general manager of a mental handicap unit. And I'm familiar with this sort of problem because in those days we had a target to remove children from mental handicap hospitals. And I make these comments that I'm making now as a manager. Public sector planning can just mean a document all carefully worked through with timelines, targets and many wise words. A plan isn't a document, but something that is actually going to happen. And it doesn't mean anything if there's not somebody charged with implementing it, and for whom there are consequences, frankly, of both success and failure. And I was staggered to hear Baroness Hollins pointing out that some of the people who appear to be responsible for implementing this don't know how many people they are responsible for in this situation. We need money to sort some of this out, I'm sure, but actually a person is the most important first step. Money can be wasted and a responsible person can fight for the money. And of course, quality and safety are vital. This is not just about getting people out of one bad situation in a hospital or inpatient unit and putting them in another bad situation in the community. Now, I won't labour what happened 35 years ago, but it happened. There was money and there was responsibility, and it happened. And I remember quite a lot of pressure coming down the system to me as a unit general manager to make sure it happened. And at that stage, no more children were living in hospitals. Now, it may not be quite like for where we are today, but it's tragic to hear how far backward we have gone in 35 years. So my questions for the Minister, of course, are, what is the plan? Who will be personally responsible for delivering it? And will whoever is personally responsible also have be impacted by failure or success in achieving the plan? Let me also add, this is just the sort of rather small scale in the sense I'm talking about, small kind scale sort of thing where ministerial leadership can make a massive difference. If a minister took an interest and really made it happen, they could make it happen. So I know it's not the Noble Lord the Minister's brief, but will he raise this with his ministerial colleague, the Minister for Care? And my simple point is, who's going to get a grip of this?
My Lords, Baroness Brinton is taking part remotely. I invite Baroness Brinton to speak.
My Lords, I congratulate Lady Hollins for securing this important debate, especially with her expertise following the excellent review she led 2 years ago. And I also, again, declare my interest as a Vice President of the Local Government Association. The Health and Social Care Select Committee's report, published on the 13th of July this year, makes it absolutely plain that 10 years on from Winterbourne View, the provision for autistic people and those with learning difficulties is placing far too many in residential settings, and it's unacceptable. And Jeremy Hunt MP, the chair of the Select Committee, said, despite commitments by governments over the years, the totally inadequate level of community provision means that autistic people and people with learning disabilities are wrongly admitted to inpatient facilities and detained for a shocking average of 6 years. It is time to recognise that a voluntary approach to reducing numbers has failed, and long-term admissions should now be banned, with alternative community provision set up in their place. The Select Committee report follows on from Lady Hollins' Oversight Panel review, saying once again that this is an emergency and needs dealing with immediately. So can I start with what's probably my final question as well? Can the Noble Lord the Minister say when the government will announce not another plan, but when it will announce the recommendations and how they will be delivered? I welcome Lord Crisp's comments about 30 years ago. 25 years ago, when I was Chair of Education in Cambridgeshire, it really felt as if this country was beginning to become progressive in its approach to ensuring that those with learning disabilities and autistic children should, wherever possible, be living with their families or in their communities with support and going to their local schools. We believed we had changed things. The evidence is, as Lord Crisp has said, that too many people are now being warehoused in unacceptable settings. For some people, specialist residential provision has been developed over the years, but now complex commissioning rules with health and local government again fighting over the costs, as we heard about in our previous debate. Additionally, the lack of funding from central government to local government for this specialist provision, as well as the general funding crises that local authorities are facing following about 30% of cuts to their overall budgets, means that there is a real problem, and it appears that shortcuts have been taken. Noble Lords have also spoken about the further worry of restricted practices. The horrors of Winterbourne House, covert videos showing staff treating inpatients badly was seared on the public soul. Everyone said this must never happen again. But my lords, the evidence is that it continues. Indeed, there was a video of a staff member dragging a young autistic person by his hair only last month in a school. As both Lady Hollins and my noble friend Lord Addington have said, this speaks to the lack of supervision and the lack of training of staff in these institutions. As the Select Committee report said, none of this is worthy of a 21st century healthcare system. I'm grateful to Lady Hollins for giving a successful outcome for one patient now living successfully and happily in the community. The problem is the lack of inertia and structural problems with commissioners and funding, meaning that 2,000 are still inappropriate settings at best, and at worst, living their lives with their human rights being ignored. My lords, immediate action is needed now.
My lords, I want to start by thanking the noble Lady Baroness Hollins for her sensitivity, for her work on this crucial matter, and today for her use of her voice in giving voice to those who don't have a voice. And the manner in which this debate has been conducted, I think, has spoken many volumes. When people are in the wrong environment, they suffer trauma, deep unhappiness, ill health, abuse of their human rights, lack of dignity, the list goes on. So I ask myself, why is it the case that somehow those who have learning disabilities and or autism are seen to be less worthy of the right environment than those who do not have a learning disability and or autism? And my noble friend Lord Tuig said that we should be ashamed of the years of failures and that this is a stain on British society. And I agree with my noble friend, because we are judged as a society on how we treat those in greatest need, to whom we owe the most. And the noble Lord Crisp spoke of people getting stuck and their situation deteriorating because of the so-called care environment in which they have been put. This, my lords, is not acceptable. And it is a sorry and lengthy catalogue that I say to the noble Lord the Minister. I hope that he will have commitments today to put an end to. It's a sorry catalogue of missed targets. And every figure that we refer to isn't just a figure. Each one of that number represents a person, and not just that person, but it represents their family, their friends, their work colleagues, their communities. All of them carry that suffering along with the person. And I found myself, as I'm sure that many noble lords did, shocked by what I understand of the situation. And Baroness Bull made a very good point that, shocking though the figures are, they are actually small enough to make an impact. And I do hope that the noble Lord the Minister will outline to the House today how he will undertake with his colleagues to absolutely put an end to this outrage once and for all. And the figures that shocked me were not just that there are over 2,000 people with a learning disability and or autism in inpatient units, not just that there are 210 children there, but that the number of people in units have gone up by 40. This is from the end of September. They've gone up by 40 since the previous month, so we see no sign of change. But the figure that really tells me the story that we are here to address is that the average length of stay for people with a learning disability and or autism in inpatient units is 5.4 years. That is 5.4 years that no person will ever get back. And we have heard in the debate about the thousands of reported incidents of restrictive interventions, physical and chemical restraint. So that most recent data shows that 1 month alone, July 2021, we saw over 4,000 reported incidents, 930 of those against children. And I go back to the point that has been made repeatedly in this debate that I would ask the Noble Lord the Minister to address, that actually much of this is because of the environment, not anything else. And how can it be justifiable when we know that, as Baroness Hollins said, that the costs of keeping somebody in an inappropriate environment is no less than it is to keep them in a caring and happy and appropriate environment. So the finances do not stack up. And again, perhaps some word from the Noble Lord the Minister on how the finances are worked out, as well as the quality. So we find ourselves in a shocking situation. We know that, for example, the Mental Health White Paper, which was issued in January 2021, actually made an important step that learning disabilities or autism will no longer be grounds for detention under the Act. But can the Noble Lord the Minister update us on the timetable for bringing forward the legislation? And we know that the government has recently published the results of the consultation of the White Paper in June, and there have been positive responses on the necessity of these reforms. So it would be helpful for us to know, one, when that legislation will come forward, but obviously key to this debate today, when will there be a grip? How will there be a grip? And by what means will the Noble Lord the Minister measure the fact that the right progress has been made to protect and advance the interests of every individual about whom we are speaking today?
My Lords, can I start by thanking the Noble Baroness for securing this important, incredibly heart-wrenching debate today, and for leading the work of the independent reviews of people with a learning disability and autistic people in long-term segregation. I'd also like to thank the oversight panel that works with the Noble Baroness on the vital issue for their report and recommendations, which the government wholeheartedly welcomed and responded to in July this year. Some of the stories we've heard were extremely heartbreaking and extremely concerned to hear about the number of people who remain in long-term segregation and, in too many instances, the unacceptable poor care to which they are subject. As the Noble Baroness rightly says, no one should be detained where they do not need to be and where they can live a full life in the community. But we know that, sadly, this is still happening, and it is, frankly, not good enough. The government is committed to taking action, both for those already detained, who can and must be discharged, and to preventing people who do not need to be admitted from doing so in the future. And we must move away from responding to crises to ensuring the right care and supporting legal framework is in place from the very beginning of someone's life. We are determined to reduce the number of people with a learning disability and autistic people in mental health hospitals, which is why we are investing more than £90 million of additional funding in 21-22 in community services and support for discharges. The government is also undertaking wider action, which I hope I will set out to address the important points raised in this debate and aim to address as many of the points made by the Noble Lords in the discussion today. The Noble Baroness Hollins started off by talking about housing in the Noble Baroness's address. There is clear evidence, yes, that the right housing arrangements can deliver improved outcomes and meet people's preferences to remain in their own home. And we agree that, as the Baroness says, that the right housing for people with learning disability and autistic people, but it's not always available and as quickly as we would like. So in England, we're providing funding to build specialised housing through the Care and Support Specialised Housing, the CASSH fund, for older people and adults with learning and physical disabilities and mental ill health. £71 million will be provided for the care and support specialised housing in 21-22. In England, we fund the Disabled Facilities Grant to support eligible people, including people with learning disabilities and sensory impairments, to adapt their homes to make them safe and suitable for their individual needs, subject to a means test, eligibility criteria and a needs assessment. £573 million has been provided for this in 21-22. And housing is one of the 6 priority work streams of the Building the Right Support Delivery Board and will form part of the upcoming board Building the Right Support Action Plan. The Noble Baroness Hollins, but also the Noble Lord Addington, also raised the issue of training and expert staff. And we accept that the right workforce is critical to enabling the highest standards of care and support for people with a learning disability, but also autistic people. Skilled staff, leadership and creativity can be key in supporting someone towards discharge. And for those in long-term segregation, the launch of the Senior Interveners pilot is vital. The senior interveners have been recruited, and we hope that they will help to remove barriers to bring creativity to planning and moving people towards discharge. And the senior intervener role will bring with it the necessary expertise and experience to assist in overcoming some of those barriers to progress. More generally, we've provided £1.4 million of funding for the development and trialling of the Oliver McGowan mandatory training to improve awareness and understanding of learning disability and autism for health and social care staff. Hundreds of staff have already been trained through the trials. And the government recently announced at least £500 million over 3 years to fund social care professionalisation, to improve workforce wellbeing and other issues, especially for those who work with those patients with autism and learning disabilities. As set out also in the Right to be Heard, our vision is that in future all professionals will, before starting their career or through continued professional development, undertake training so that we can be confident there is a consistency across the education and training curricula. And the government is currently working with the Health Education England, the Medical Schools Council, regulators and medical schools to establish the best approach to developing a core curriculum. And in addition to how we improve inpatient services supporting autistic people, we are investing £1.5 million funding to develop training for staff in adult inpatient mental health settings. I know the Noble Lord said that there were much wider issues around mental health, but it also includes in line with Tier 3 of the Core Capabilities Framework for supporting autistic people. Now, as part of the training programme on the Oliver McGowan mandatory training programme on learning disabilities and autism, we are working with a number of people, backed by that £1.4 million investment. And subject to evaluation, this should be available for all 2.8 million health and social care staff on autism and learning disability. Workforce, as I said, is one of the 6 priorities. As part of the new national autism strategy as well, we're taking a number of steps to improve understanding of autism amongst educational professionals, as well as the training that we've already announced here. There are also incredibly important reports and recommendations, especially the ones from the Human Rights Committee, the Health and Social Care Committee, CQC Oversight Panel. The Building the Right Support Delivery Board has been established to drive further, faster progress, exactly on the number of issues that a number of Noble Lords raised today. And we're considering how to bring these together and these recommendations as part of Building the Right Support Action Plan, and that will require cross-government, cross-system effort, as many Noble Lords have said. Also, we want to make sure that there's better reporting on a number of people being detained. The government is fully committed to reducing restrictive practices and poor care for people with learning disability and autistic people. And reporting on progress on the use of these restrictive practices is an important part of that. That is why the mental health units Use of Force Act statutory guidance, which we recently consulted on, sets the reporting requirements for restrictive practices under the Act. The statutory guidance makes reference to the mandatory requirements to report this information in line with current NHS England and NHS improvement requirements. We will publish the final guidance reflecting feedback from the public consultation later this year. And the Noble Baroness, I'm sure, will be aware of existing reporting and data, which is also already published. NHS Digital published their annual mental health bulletin and monthly public dashboard about the use of restrictive interventions and monthly assuring transformational data about the number of people with a learning disability and autism in inpatient settings. Noble Baroness Hollins, and maybe one or two others, all Noble Lords, also raised the issue of changing the rules so that care workers can enter the skilled worker immigration scheme. I think we should all acknowledge the valuable role that immigrants bring to our economy. And within the social care workforce, nurses and occupational therapists and social workers are eligible for the health and care visa. The new health and care visa will make it cheaper, quicker and easier for eligible social care professionals from around the world to come to work in the UK. We hope to attract the best talent from around the world. And Noble Lord Addington asking, have we got training for staff to de-escalate and minimise restrictive practice? NHS England and NHS Improvement has commissioned the rollout of the HOPES model, a national training model to be delivered through NHS provider collaboratives to reduce the use of restrictive practice and long-term segregation and to develop positive cultures. The HOPES model will follow a human rights-based approach, will be person-centred and also informed by experiences of trauma. A number of Noble Lords raised the issue of trauma, and we think it's really important that we address that. And please, I would welcome feedback from Noble Lords across the House who've taken interest in this issue to make sure that we are on the right path. And one of the things I do want to dwell on a little bit, if I may, is the senior intervener role, and the role which is being trialled in response to Noble Baroness Hollins' recommendation for the introduction of an additional senior person to support local services to plan for discharge, guide where there is challenge and agree actions to facilitate a reduction in restrictions. It's important that we do this planning and we are planning for discharge as the ultimate goal. And the project builds on the positive evaluation of the pilot of children and young people's senior interveners. And the ultimate goal of the senior interveners is to establish and oversee this robust programme, making sure that we are all working towards discharge from both long-term segregation and hospital. And I think I was asked by a number of Noble Lords about the independent case reviews, especially Noble Baroness Hollins. We've accepted the recommendation made by the Noble Baroness Hollins and the Oversight Panel to resume independent case reviews for those in long-term segregation. And we're working with NHS England, CQC, to ensure ICETRs will restore as soon as possible. But it's important that the reviews take place are high quality and we have the right panel of experts in place. And we're trying to work to this as fast as possible and in the context of the COVID-19 pandemic. A number of Noble Lords asked about the Winterbourne view and targets. We have a clear target in the NHS long-term plan of 50% reduction by 23-24, and we are taking action across several fronts to achieve this. There are more than 10,000 discharges since March 2015 and 28% net reduction in patient numbers. We accept that it does not meet a target of the 35% reduction previously set out in March 2020, but we hope very much to continue and make some real progress. The Noble Lord Tuig talked about mental health issues and Mental Health Act reform, and what's really important is reforming the Mental Health Act and the white paper published in January 2021. We've consulted publicly on the proposals and we published the response on July 2021. I will try, if I can, to resume and answer as many of the other questions. I know both the Noble Baroness Bull and the Noble Lord Tuig also talked about limiting the scope of detaining people with learning disability or autistic people treatment. The proposed reforms will create new duties for commissioners to ensure an adequate supply of community services and make every local area understand and monitor the risks of crisis at the individual level. I would like to say more about commissioners if I can, but maybe if I haven't answered some of the questions of the noble lords in this time allotted, I hope that you will write to me so I can give you all noble lords a more thorough response. But I end by thanking the noble Baroness for this important debate. I think no noble lords will agree that all parts of the system must play their part and take action so that no one is detained when they do not need to be. Hospital must always have a therapeutic purpose and only be for as long as is absolutely necessary. And we hope that the actions we set up today, both short-term and longer-term, and we'll write to noble lords about, the significant reforms demonstrating the range of activity already underway or planned. We hope that this will help to ensure that we prevent people with a learning disability and autistic people from being detained when they could live a full life in the community with friends and family as each and every one of us deserves. Once again, I thank the noble Baroness Hollins for securing this debate and look forward to working with her in the future.